One Zambia, one nation. Hello and welcome to Zanis News. I am your presenter, Henry Himonde. A look at the top stories. Government orders closure of illegal mine hit by cholera. ZAMSA procures second batch of drugs from Egypt. And government infrastructure in Lufanyama to have solar geysers and water pumps. And now the news in detail. Rufunsa District Commissioner Richard Mabena has ordered the closure of an illegal mine in Pokela village which has been hit by cholera. The mine, which is in Chieftainess Mpasha's chiefdom, has so far recorded 2 fatalities from the pandemic, while many others are being rushed to nearby health facilities. Environmental health technologist at Mpasha's St. Luke's Mission Hospital, Mijelo Milambo, who was at the site, confirmed that 2 people from the mining area have died of cholera. Here is a report.
This is an illegal gold mining area in Pokera village in Chieftainess Mpasha's chiefdom in Rufunsa district, which was recently found by some youths. It has attracted a cross-section of people doing illegal mining. Unfortunately, this place has been hit by cholera and 2 people have since died. Environmental health technologist at Mpasha Mission Hospital, Michelo Mirambo, who is at the site, has confirmed the 2 deaths.
At the hospital, we have about 10 cases of people who are in critical condition, and we have 2 brought-in dead bodies that came from this place.
Area headman Crispin Muchimwa now explains what is happening in his area.
Kupokera kwange na washimaini wambili wakumba god manje kuli outbreak ya cholera. Already kuli almost 15 my patients bamene wali ku hospital, so far watenga wawili kwenda nao ku hospital again.
Rufunsa District Commissioner Richard Mabena, who rushed to the site with a team of police officers, DMMU and health staff, has told the illegal miners to immediately vacate the area.
Headman Pokela here, where there have people who have come from different parts of Zambia to come and do illegal mining of gold. And because of the issue of cholera, as the district commissioner, I've decided to close and tell anyone to leave, vacate this place. Only those who have got artisan mining licenses and those who pay tax to the government and know the procedures will be allowed to come back. But currently, I'm not in support of anything. As the government, we don't allow illegal mining in Zambia at the moment.
The illegal miners have commended government for the move.
Government in that pasago, I mean, it is the security at Vuti Sana Ngubwanji, but at Tandi's Ajabi because the situation is really bad. Kolela wantu wambili ukiambache kwa mairu mazulu kufika lero wantu wambili che wankala si okay wankala wotu wala watu watenda maningi.
Reporting for Zanis in Rufunsa district of Lusaka province, I am Musekiwa Ntembe.
And in Southern Province, Provincial Health Director Karistas Kayunga has called for enhanced stakeholder participation in the fight against cholera. Dr. Kayunga says if the fight against cholera is to be won, stakeholders, especially community members, must do their part in adhering to high levels of hygiene, which includes keeping surroundings clean. The Provincial Health Director says the province has, since the outbreak of cholera, recorded 26 cases in different districts, with Sinazongwe having the highest. Peter Piri now gives us more in this report.
With cases of cholera being recorded in a number of districts across the country, health authorities have heightened measures to prevent spread of the disease. Southern Province Health Office has called on the general public to adhere to the general hygiene measures so as to prevent escalation of the cholera cases in the province, now standing at 26. Dr. Kayunga has also advised those that may have symptoms of cholera to immediately report to the nearest health facility.
We have a total of 26 cases reported as of today. These 26 cases includes those that are confirmed with a laboratory test and those that are suspected and linked to some of the confirmed cases. We have 6 of our districts reporting cases, with Sinazongwe having the highest number, reporting 6. I am happy to indicate that in the last 24 hours, as Southern Province, we have not reported any new case of cholera. We want to encourage our communities to say cholera is real, but cholera is easily preventable and treatable. So what we would expect from members of our community in Southern Province is that we must all unite to fight against cholera.
For marketeers at Makalanguzu Market, non-collection of garbage amidst cholera outbreak remains a concern. Meanwhile, Choma Municipal Council Health Director Mchoka has attributed the delay in collecting the garbage to the breakdown of the garbage collector loader.
Started the program with Shampande and Kalpungu Market. These were cleared, and unfortunately, as we were moving to Makalanguzu Market, we experienced a breakdown on our tractor backhaul loader, and hence that situation which is obtaining now.
Cholera outbreak has forced authorities in the country to defer the reopening of schools by another 3 weeks. Reporting for Zanis in Choma, Peter Piri.
Meanwhile, Lusaka Province Health Director Simulia Mana Chonga has assured residents that the cholera vaccination exercise will commence soon and priority will be given to hotspot areas in the province. Dr. Chonga says vaccines are expected to be in the country next week. Evelyn Masialeti now gives us more in this report.
Government has reaffirmed its commitment to putting in place various interventions that will help fight cholera. Some of the interventions that have been put in place include the provision of clean and safe drinking water, distribution of chlorine, sensitizing communities on the dangers and how cholera is spread, and vaccinations. Lusaka Province Health Director Simliamana Chonga says vaccines against cholera are expected to be in the country by next week.
Maybe within the next 1 or 2 weeks, we should have the vaccines. And once we have the vaccines, we obviously focus we'll have a focus on the most at-risk people. And that will include obviously health workers who are exposed in the cholera treatment centers. We'll make sure that they get the vaccine.
And Kanyama residents have appealed to government to quickly start the cholera vaccination exercise.
Let us stand up in numbers to get the vaccine in order to prevent cholera.
Once the vaccine is here, we will not hesitate to get vaccinated. We need it as soon as possible.
However, Kanyama First Level Hospital volunteer has noted with concern that water bowsers are unable to reach some areas which are in need of clean and safe drinking water.
We have a challenge in our community. Some areas are not reachable due to loose disco power cables.
Government has so far erected over 80 water tanks in cholera hotspot areas and will soon embark on a vaccination exercise to help fight cholera. Evelyn Masialeti, reporting for Zanis in Lusaka.
And in Eastern Province, government has embarked on a project to improve water and sanitation situations at selected schools in Chipangali district. St. Margaret Girls and Tamanda Day Secondary Schools are some of the beneficiary institutions where modern ablution blocks are being constructed. The project is being supported by the Ministry of Water Development and Sanitation and managed by the local authority. Here are the details.
Access to improved water and sanitation services is key to maintaining good hygiene, especially now that the country is fighting the cholera outbreak. It is in this light that government has continued to work towards improving the water and sanitation situation in the country, with the latest being Chipangali district, where sites for the construction of modern ablution blocks at St. Margaret and Tamanda secondary schools have been handed over to the contractor.
We brought a contractor on site to come and commence the works for construction of an ablution block. These ablution blocks are supposed to have a full reticulation system for water. So these are flushable toilets. It must be noted that this one here is for all of the 8 ablution blocks and going all the way to erect the 4 boreholes. So there are 2 boreholes in Lumezi, 2 boreholes for Chipangali.
And Chipangali Member of Parliament Andrew Lowusha says more of such projects will be undertaken using constituency development funds.
But want to assure you that even under CDF we've been supported with enough funds, and we are going to embark on building of modern ablution blocks in all health facilities and all schools. So be rest assured that besides this, we will equally support you under the CDF. We are extremely grateful once more to the Republican President and the government for the noble support and for this blessing that has come at the right time when we've got cholera threat. It will definitely help us reduce the cholera threat and so on.
Meanwhile, traditional and school authorities are thankful to government.
And this time the use of pit latrines is not all that okay. Now with the coming of the new one, we really appreciate.
We feel our people's, their lives will be eased because they will not carry buckets to go and draw water. They will just go into the shower room, take a shower, and they go to class.
The contractor has committed to complete the projects within 6 months. Abigail Kashweka reporting for Zanis in Chipangali district.
Now, a multidisciplinary team led by Parliamentary Committee on Health Christopher Kalila has arrived in Egyptian capital Cairo to conduct a pre-inspection routine of the second dispatch of drugs that government has procured through the Zambia Medicine and Medical Supplies Agency, ZAMSA. Zanis reports that the team comprises officials from ZAMSA, Zambia Medicines Regulatory Authority, ZAMRA, Cabinet Office, and the Ministry of Health. This procurement of essential medicines and medical supplies was made possible through the Unified Procurement Authority established by the Arab Republic of Egypt. Pethias Mtale is in Cairo and filed in this report.
The second batch of medicine and medical supplies that government procured from Egypt through the Zambia Medicines and Medical Supplies Agency, ZAMSA, will soon arrive in the country. And a team of medical experts has since arrived in Cairo for pre-shipment inspection routine. Confirming the arrival of the team in Egypt, Zambian ambassador to the Arab Republic of Egypt, Major General Mulambe Lubaya, expressed Zambia's desire to enhance cooperation with Egypt in various areas.
We have the ZAMSA pre-shipment team that arrived yesterday to come and do some inspections of the medicine that we ordered from Egypt. It also shows that what Africa is advocating for in terms of intra-Africa trade agreement, it is going to be fulfilled, as many countries within Africa must be encouraged to trade amongst themselves. Indeed, without the political will of His Excellency, the President, Mr. Ende Chilema, the Minister of Health, Honorable Sylvia Masebo.
Chairperson of the Parliamentary Committee on Health, Dr. Christopher Kalila, who is part of the delegation, praised the government for this achievement.
I am part of a multidisciplinary team that has been put together by the Ministry of Health to, actually as a second batch, to come and conduct a pre-shipment inspection or assessment, if you like, for the bulk supply of essential medicines from the Republic of Egypt to Zambia. And thanks to the efforts of His Excellency, the President of the Republic of Zambia, for his leadership and interest in the health of our citizens.
Maxwell Kasonde, who is Assistant Director Pharmaceutical Services at the Ministry of Health, is the delegation leader, and his team has already hit the ground running. Indeed, the Egypt bulk purchase will play a pivotal role in bridging the gap in primary and tertiary health care services. Pethias Mutale reporting for Zanis in Cairo, Egypt.
We now take you to Central Province, where Provincial Permanent Secretary Muna Mwanakampwe has advised councils to ensure that all health posts built with the use of Constituency Development Fund CDF include maternity annexes, water reticulation, staff accommodation, and medical equipment before they are operationalized. Mr. Mwanakampwe says the support infrastructure will enable the health facilities to operate at full capacity, especially in underserviced areas. Shupekile Nkunika reports that Mr. Mwanakampwe said this when he inspected the newly built Fiwanga Rural Health Post in Mukushi, constructed at a cost of 289,000 kwacha.
Isolated and remote, the people of Fiwanga, 15 kilometers from Mukushi Boma, had to cover long distances to access medical care. This was a challenge, especially for women and children. But with the 2022 Constituency Development Fund, Mukushi Council has built this health post at a cost of 289,000 kwacha. Central Province Permanent Secretary Muna Mwanakampwe has inspected the health facility, whose works have since been completed.
But we want to commend the contractor. He did it very well within the time frame, although late by 1 month.
Provincial Health Director Elijah Mtokoli is impressed with the construction of the health facility.
Hoping that you even consider an annex. However, because it's already finished. So if it's possible to make the process a bit faster so that maybe within 3-6 months we can come in.
To be a good structure and immediately is put to good use. I think government will appreciate because
Mr. Mwanakampwe wants support structures to be constructed to complete the health posts.
When we give this project a priority, we will not allow the people of Fiwanga area to be covering more than 12 kilometers to access medical facilities. I would appreciate within the first quarter, look at how quickly you can put a maternity annex here, water reticulation, and also let us look at the aspect of equipping this place here.
Shupekile Nkunika for Zanis in Mukushi.
We now move to Northwestern Province, where the construction of the Mushindamo District Police Station has been completed and is now awaiting official handover. The facility has been constructed using the 2022 Constituency Development Fund at a cost of 2.3 million kwacha. Kalan Mchima now reports.
The 2.3 million kwacha Mushindamo District Police Station, constructed through CDF, is complete, with the contractor doing final minor touches. The new police station has 11 offices, which include an armory. The facility also comes with 2 big cells for both males and females, all fitted with a shower, a toilet in each cell, plus 24 hours running water.
I personally, I was put in one where for me to breathe and to put my nose down just where there was a little space here at the old police station. And I was told that you are coming to stand as an MP in this place, you must build better cells. And this is a better cells being fulfilled by that proclamation of one of our police officers. As you can see, we have flushable toilets, we have the shower section, so that when we have people incarcerated, it does not mean we are punishing them.
Other than the toilets and showers in the cells, there are also more of such facilities for the rest of the members of staff. The office for the officer in charge also comes with a big office space for the secretary, and in the main office, you will also find a shower and a toilet.
Indeed, anyone can come and prove that CDF is working. And from Shindamo, we are actually that example, that testimony. In all the 8 wards that we have, in all the 5 chiefdoms, there are at least 4 or more projects that we've done.
Currently, police officers are operating from this dilapidated structure. This room here is the current cell at the only police station in Mushindamo district, while the officer in charge is also using this container as his office. Undoubtedly, The construction of this new police station will boost the officers' morale in the execution of their duties. Kalan Muchima, reporting for Zanis, in Mushindamo District, Northwestern Province.
As we continue with the news, government is to start installing solar geysers and water pumps at all staff houses being constructed under the Constituency Development Fund CDF in Lufwanyama District on the Copperbelt Province. The development is aimed at improving accommodation standards and motivate workers serving in remote areas, especially under education and health sectors. Lufwanyama Member of Parliament Ken Siachisumo said this when he inspected some CDF-funded housing projects at Mukutuma Rural Health Center. Agrippa Silumbwe now gives us more in this report.
It is a semi-detached staff house under construction at Mukutuma Rural Health Center in Lufwanyama District. The house is already fitted with solar geyser, piped water, water tank, among other modern components. Lufwanyama Town Council has adopted this as one of their models for CDF housing projects, especially for workers serving in remote areas.
We are in a hurry to develop our district. We are happy the projects are moving on well. To our president, Hakainde Chilema, he has increased the CDF.
And the Lufwanyama lawmaker says government is determined to continue raising accommodation standards for its workers.
And will continue serving the community to make sure that everyone is going to be happy with this new Dawn government, which is doing very, very well, where projects are concerned and some other facilities. The workers are members of Lufwanyama. We are together in Lufwanyama, and this is our home. Let us make sure that the properties which have been bought at a very, very expensive money, we look after them so well. Previously, these things were not found in the district.
The district has so far benefited over 7 staff houses and health facilities in the health sector alone under the increased Constituency Development Fund, CDF. Reporting, I'm Agrippa Slumbo.
And finally, residents of Nsumbu in Sama District, Northern Province, are elated with developments taking place in the area as a result of the Lake Tanganyika Development Project. Lupili A village headman Albert Songwe says the construction of institutions such as mini hospital, schools, a fish market, and a skills training center will improve the welfare of people in the area. Take a look at this report by Wope Sendwe.
Nsumbu Sub-District in Sama of Northern Province is receiving a facelift, all thanks to the Lake Tanganyika Development Project. The project, which is implemented through the Ministry of Green Economy and Environment, has not only achieved the promotion of sustainable use of natural resources, but also the provision of socio-economic infrastructure for the people in the area. The Ministry of Green Economy and Environment Permanent Secretary inspected the infrastructure projects to appreciate the progress made.
There cannot be biodiversity conservation without involving the communities around. So under infrastructure development in the same project, we have built a number of schools, a number of health centers, but this one is the biggest. So this is how we are linked to a hospital.
TVA project ya kubomba ukuchingira ifirengwa na lesa on one hand, then on the other hand ukubombera ukuchita improve ama livelihoods y'abantu abekaramu along the Lake Tanganyika.
Among the projects being implemented is the construction of a mini hospital to improve healthcare services in Nsumbu and surrounding areas.
Pogelela buno nachuwa mishafe sana pantu umushina ukula. Chimo fena district ama ofisi yonse twali kumanya ichipatala fecho tatwagwete ekikalamu. Apo natuchitegera twala kwatako n'ababomfi abengi ero nefibombero efingi fya pano pene pa chipatala. Natutemwa sana kai nachuwa sana.
Natutemwa sana akutukulire chipatala pantu na chitwaita twairo byantanshi.
Northern Province Permanent Secretary Bernard Mpundu, who accompanied his counterpart in the Ministry of Green Economy, says the project provides communities on Lake Tanganyika shore alternative sources of livelihood.
Lake Tanganyika project is a project that came to come and, remove that idea of the local people, those who are living within the the basin, Lake Tanganyika basin, to just be dependent on the lake. The fish is depleted.
And the contractor commended the government for engaging local construction companies.
We have the expertise, we have the technical know-how and experienced people, as well as the equipment to do this kind of jobs. So the more they encourage us, the more we expand and grow as a company.
The project aims to improve the quality of livelihood of populations depending on the Lake Tanganyika and to protect the ecological integrity of the lake basin. Vupa Sendo for Zanis in Nsama District, Northern Province.
That item brings us to the end of the news, but before we go, let's take another look at the top stories. Government orders closure of illegal mine hit by cholera. Zamsa procures second batch of drugs from Egypt. And government infrastructure in Lufanyama to have solar geysers and water pumps. Thank you so much for watching the news. On behalf of the entire news production crew, my name is Henry Himonde. Until next time, it's goodbye.